Okay, I'm going to give an intradermal injection, Z-Track method, and first I'm going to do the 6 rights, right patient, right drug, right dose, right time, right route, and right documentation. I'm also going to wash my hands. I'm going to check the MAR and the doctor's orders. And then I'm going to get my medications together. I'm going to check both of these, make sure they're not expired, and make sure they're the right medications. Pop these off, just like that. And we'll start by alcohol prepping both. On the other side. Okay, and I'm gonna read the back, and it looks like to reconstitute we need 5.6 mils to get 500 milligrams per milliliter. So I'm gonna get a 10 mil syringe, a needle, okay, and I'm gonna uncap it. And first I'm gonna draw back the 5.6 of air. Okay. And I'm going to inject the air into this vial. And then start drawing back 5.6. Almost right there. Okay, flip it upside down. Take out your medication. Make sure there's no air to get exactly the 5.6. Perfect. Okay, and then I'm going to take this needle and we're going to put it in here and inject all the liquid into this vial. Okay. I'm going to recap this safely. Put it in a sharps container. Roll the medication to mix it. Check to make sure it's all mixed. Don't ever shake it. Just keep rolling. Until it's all completely dissolved. Do not drop your medication. That would be key. I would not do that. And looks like it is completely mixed. Okay. I am going to wipe down the top again, just to be safe. And instead of putting a new needle on my 10 mil, it did say in the instructions to have a 3 mil, 22, 1.5 gauge. So that's what I grabbed instead. So this is a new needle. So uncap it. And I'm going to grab up 1 mil. Oops. Actually, first, let's do our air. So 1 ml of air. Now we're going to inject the air in here. Pull up 1 ml of medication. Make sure to get all the bubbles out. Perfect. Cap it. But you would use safe technique. Don't do what I just did. Table, then scoop. And I would take a needle with me, seeing as I just stabbed the container with that one. 22, same size. Okay, and then I'd go to the patient's room. And here's my patient. I would get their name and date of birth for the 2 identifiers. And I would also explain what I was going to do, that I was going to give them an injection right here on their side here in the vestibular, I think it is. So then I would wash my hands, find a pair of gloves. These ones are really hard to work in, but you guys are seeing that I put them on. I won't really wear them, but I'm wearing gloves this whole time. And first I'm going to have them lay down on their side so that I can get to this area better. And then I would use my landmarks. I think it's the iliac crest, and then here, and I would go right between this finger here. Okay, so I would first alcohol the area in to out. And while that's drying, I'm going to change on my needles since I had poked the container with this one and we want it to be as sharp as possible. So I'm going to twist that off. Put a new needle on. And I'm going to uncap. And with the Z-Track, you're going to want to pull the skin. So you grab and pull. And then we're going to go in at a 90 degree. Bloop. This needle will go all the way through. My person's a little short, but stabilize with this hand. Aspirate. No blood. And so you would slowly, over 5 to 10 seconds, put your medication in. Okay. Pull out. Sorry, it's going to make a mess. And then this would go into the sharps container. I'm going to cap it here because I don't have one. Sharps container. And then I would dab for any blood with gauze, Band-Aid. Make sure my patient is in a safe, comfortable position. I'm going to clean this up real quick because it just made a mess all the way to my phone. And then I would go and document on the MAR as well as my nursing note where the medication was given, what dose, and the route. And that's it.